My name is Destiny Fitzpatrick, and I will be presenting on the evaluation of the CINC residential program. So while working within the Volusia County Public School District, one of the biggest things that I've seen that we are struggling with is attendance, which once I did my research on it, it is not only just a Volusia County or even a Florida issue, it is a countrywide issue. According to the Department of Education, back in the school year of 2015-2016, there were 7 million students that were identified as habitual truant within the year, which was at that time 16% of the nation's students being in school, which is a very high number. So within the Volusia County School District, we have done a lot of different things to try to combat the habitual truancy list. And to those who may not know, a habitual truant is somebody who is between the ages 6 to 16 who have missed 15 calendar days within a 90-day period, regardless if it's suspensions or anything. If they're unexcused days, excused days don't count. Unexcused days, anything that's unexcused, and if you once you reach that 15 and it's unexcused, then you need a doctor's note any day after that. Like I stated, 15 within the 90-day, unexcused, you're habitually truant. And there are a lot of different factors that may contribute to a student being listed as habitually truant. One of the biggest that we've seen within the county was the behaviors, regardless of a student being suspended from school or giving their parents a hard time about attending school. The behavior piece is one of the contributing factors to the habitual truancy. And being habitually truant in school not only sets the student up for not being able to graduate, but also setting them up through a negative path as an adult in life. And once a student is identified as a habitual truant, they are at risk of having poor academic performance as well as delinquency, because if they're not coming to school during those hours of school, what are they doing? That leaves them just at risk of participating in delinquent behavior. School dropout. If a student feels like if they don't come to school, then eventually they might feel like just not coming no more at all, which that leads to employment issues in the near future when you're an adult. If you don't have a high school diploma, if you feel like you had to drop out when you were younger, and you didn't receive your high school diploma, that is going to make it hard for you to even find employment and be a successful adult. So CINC residential program stands for Children/Families in Need of Services, and it's a program that is funded by the Stewart Marchman and DJJ, which is the Department of Juvenile Justice. And it is specifically created for students who are habitually truant, runaways, ungovernable, if you will, and students who are exhibiting behavior concerns not only at home and in school as well. And it can work as a resource not only for the parent, for the student, but the parent as well, because it will also teach parents how to communicate positively, not only with their child, but also with school administration. And they will teach them that during family therapy that they're mandated to go to once a week once a student is within the residential program. At the program, they will provide food, shelter, individual therapy to the student once a week, and as well as community referrals. If the family is finished, they exit the residential program and may need another referral, we are open and we are able to give that student extra services if they need it within the community that we cannot provide. And it is utilized throughout Volusia County Public Schools. So the reason why I decided to do my program on the CINC, my program evaluation on the CINC residential program, is because not only does the research support it, but it also, I have seen firsthand that how effective it is when not only increasing the attendance amongst the students who utilize the program, but also decreasing the behaviors that we're seeing at home and in the classroom as well. And as far as the research, I came across 2 different studies that share the same component as the CINC residential program, that were both seen to be effective at the end of their studies. And for the first one, it was conducted on 210 youth in Ontario, and it was also children were given the schooling at the residential program. They were not given the option to attend school at their own school. They were just given this schooling at the residential program. And these were students that were having delinquent issues with being delinquent, poor academic functioning, and overall behavior concerns, and poor attendance. And within the study, they were students that were between the ages 10 and 16 as well, which is very similar to the CINC program. And the study revealed that 76% of the students that were 15 and younger, they were at school at follow-up, and they were at school full-time as well. For the second study that I've seen that shared the same components as the CINC residential was amongst 56 youth between the ages 13 and 17. And these were the youth that had severe behavior and psychiatric and developmental concerns. And the students were given the option, like CINC, to go to school at their own school or attend school at the residential program. And what I found very interesting about both of the programs is that they both were giving family therapy, which is similar to CINC. They both were given family and individual therapy. But the thing about CINC is that it's required. For the second study, it was not required, but they seen that it was more effective. The residential program was effective when they were more family engagement, but it was not required. Our CINC program requires students and their families to attend the family therapy once a week, just the parents and the student. If the student does not attend the therapy or the family does not attend it, then the student can be discharged early from the program. And both of the programs focus on attendance and behavior concerns, which are two big ones. That is why we get more than half of the referrals that we get at CINC because the attendance or the behavior concerns that they're seeing either at home or in the classroom. So after doing research and seeing firsthand how CINC works, because I am one of the social workers at the school, I do CINC referrals all the time with the counselor in my middle school that I'm assigned to. But the question is, to what extent does residential programs like CINC help towards graduation rates in regards to decreasing the habitual truancy rate and decreasing behaviors among students, and as well as connecting the parents to school resources such as school administration and being more susceptible to receiving assistance from the school is what the evaluation was to figure out. So here is the logic model that I created specifically for the CINC program. I will attach another one to my presentation since I see that I'm blocking a piece. But this is the logic model I created to give you guys a view of what it takes to implement a program like this, the activities that are being done with programs like this, and the goals, the overall outcome of the program once the child enters and successfully exits this program. And during the time at the program, it will give parents as well as the students like a time where they are able to take a step back from each other, get some space, and be able to positively reconnect after giving those techniques and strategies that are given by the CINC residential program from the family therapy and individual therapy that they're required to go to. And it also will hold the parent accountable as far as the attendance. If the reason why they're at the residential program in the first place is for attendance, it holds not only the parent accountable, but also the student as well. And it will decrease actually behaviors not only at home but also at school, because they'll give at the program they are given more techniques to express their feelings, as well as to be able to cope when things aren't going their ways, and be able to possibly communicate with their teachers and their parents as well. And once the program is finished, once the student exits the program, and the overall outcomes is that the habitual truancy list will be decreased throughout the county, which will increase the overall graduation rates amongst our students, which is the main goal. It will also decrease the behaviors that are being seen in class if students are given the proper techniques and coping skills to learn how to positively communicate with their teachers and things of that nature. And it will also help parents become more susceptible to receiving services or any type of assistance from the school or community resources, because what I've seen as being the social worker at a middle school, parents are extremely resistant to the services that I could possibly provide them because they automatically think that I'm a bad guy. While getting into this type of service, the residential program, parents no longer see us as that anymore because there are more positive takebacks from this program than are negative. So to complete this program evaluation, the population will be for the students who are between the ages 10 to 16 who meet the qualifications of a CINC referral, which I mentioned earlier, was either habitually truant, having behavior concerns at home or in the classroom, runaways, or at being seen as ungovernable. Once a student is identified as habitual truant, I get a list from our school database, and from that list, I will pick students from a non-probability sampling method. I want the sample size to be as random as possible because I don't want to over-represent a specific population, I guess. From what I've seen is that most of the referrals that are given to CINC throughout the Village County are from minority males. So, and I'm almost sure it's because of most counselors feel more, have more sympathy and empathy for the non-male minority parents. So they don't necessarily go with the CINC referral. They might do some other route. But for the CINC residential, I've seen more minority males. So to prevent that from happening, it will be once students are identified from the habitual truancy list, it will be randomly select. Students will be randomly select. The sample size will include 100 students. And like I said, it will be from the 10 to 16, anybody who meets that criteria for the CINC residential program. So for the strategies and measures designs that I will be doing to evaluate the CINC residential program, I will be doing it for SSRD to determine the, not only to determine the pre and post effect on the residential program, but also because it's cost effective from what research says. Research stated that while trying to collect data on school-related issues, that not only is things such as SSRDs effective, but they are also cost effective, which will cut down on the school's costs. Data will be collected using parent surveys and the adolescent school-related subject well-being scale. The parent survey consists of 5 questions versus the scale for the student consists of 45 different items for different subjects. They're both in a Likert scale form, and they will both be given pre and post intervention. So the parent surveys and the student scales will be administered by trained residential staff. The staff will be trained by the school social worker to able to collect the data before during the intake process. Actually, the pre-survey will be collected during the intake process. And it will also data that will also be collected during that intake process will be demographics, race, and socioeconomic status. To determine the student's socioeconomic status, we'll use the proxy of free lunch. We'll either ask the parent or the student if they received free lunch, and that's how we'll collect that data. But the data will be the surveys and the scales will be completed on tablets that are provided from the agency. And once the intake process is finished, the parent and the student will both be given will be put in separate rooms to complete their surveys. The student will get around 20 minutes or however long they need to complete the survey. And the parent survey is only 5 questions, so they'll have a little bit less time. The student survey is 45 questions with about 5 different subcategories. and before the parent and the student is given the survey, they will be make sure that the residential staff will make sure that the parent and the student know that the surveys are only used to help evaluate the program, and not only is the surveys confidential, but they're also voluntary as well. Once we get 100 students to enter and exit the program, we'll get the data collected on those 100 students, and it will be decoded and discussed amongst the school social worker, the school counselor, and the managers of CINC. Because we're going to use the Survey Monkey from the tablet. By the tablet, the tablets, the surveys will be used be decoded by Survey Monkey, so it'll be easier to see the numbers and the trends. And since all the surveys will be from basically the highest, from they're all Likert scale, and with 5 being strongly agree and 1 being strongly disagree, um, we'll be able to determine the if the post residential is higher, which we are looking for higher ratings. That will determine if the program was useful to the student and the parent as well. If the ratings are higher than the pre has to be lower than the post in order for us to determine whether the program was effective or not. And for the follow-up, once the student exits the program, all the students will be monitored for once a month, and we will monitor them by looking for their attendance and the discipline browse to see if they've been in school and to see if they've had any discipline browse, any behaviors that would cause them to be suspended, if think of anything of that nature. If a student has been suspended or is missing school, then we will proceed to do other measures. The biggest limitation that I've seen throughout the evaluation of the CINC residential program is that they don't take students who are identified as emotional behavior disabled or autistic, or ID, which is intellectually disabled. Excuse me. And another one that first let me finish with that statement. A lot of the students, especially in the urban areas, identify as some type of exceptionality. So with those students not being able to access that service, they're cutting out a lot of students that might be, although they might be EBD, they might still have attendance issues. They still might have behaviors at home, and they could still benefit from the CINC program. So they're missing out on a large population that they are not even considering. Another limitation that I've seen is that most of the referrals that I have seen to be done for the CINC referral is like an overrepresentation of minority males. And I know for a fact that that is not always accurate. It just seems as though we give more sympathy to those that are not more minority male, which may not be the trend in every school, but what I've seen is that they are overly represented as far as representation. Is there's a lot of overrepresentation of minority males for the CINC program. In regards to my CINC evaluation program, my CINC residential program evaluation, CINC program has many different positive takebacks to it. A lot more positive takebacks than it does negative, and it also has more benefits than any other program that they might have for the Volusia County, at least that I know of, that deals with attendance and behavior. There are a lot more benefits that come with this program. It teaches parents and students how to communicate, cope, and trust other adults. And I hope that my hopes of this evaluation was to help other professionals when having a student who is struggling with either behavior or attendance, help them figure out what program is most effective. And especially when you're thinking of the overall big picture, was to increase the graduation rates and increase the positive communication between the parents and the school administration, and to being able to create positive relationships between between parents and schools. But one future recommendation I would say for the CINC program is to grant access to all students that may meet the requirements, regardless of what their exceptionality may be, because sometimes those students who have that specific exceptionality, like EBD, may need this service the most. And with that being said, I hope that you enjoyed my presentation. Thank you for your time.